Endocrinologist Dr. Robert Lustig's lecture Sugar, The Bitter Truth, shocked global audiences by declaring everyday table sugar toxic and is evidence-backed a health hazard as tobacco. Lustig argues that the fructose half of sucrose overwhelms the liver, accelerates cellular aging. Sucrose and high-fructose corn syrup are cheap, versatile, and easier to formulate than oil, dairy, fat, or cocoa. When costlier ingredients are reduced for margin control or lower fat positioning, bitterness and texture issues appear. Sugar masks both problems, thickens sauces, extends shelf life, and meets the price targets that brand managers insist shoppers will accept. Individuals who consider themselves moderate sugar consumers frequently present triglyceride levels above 2.0 mol/L, well over the 1.7 mol/L threshold linked to heightened stroke and heart attack risk. Nutritionists report that 3 straightforward steps eliminating sugary drinks, capping packaged foods at 5 grams of sugar per 100, and swapping refined grains for intact whole grains can normalize triglycerides within weeks. Exercise, while vital, cannot be legislated. Yet the sweetness stealthily woven through everyday foods can be labeled, priced, and reformulated. Each teaspoon removed from the supply chain lightens individual risk and eases the escalating burden on national healthcare budgets. The data are in, the biological mechanisms are understood, and successful pilot programs already exist. Decisive action now rests with policymakers, producers, and every shopper who pauses to scan a label before dropping an item into the trolley. Trim several kilograms without additional exercise, and dampen cravings once thought irresistible. A Wellington couple who purged everything sweeter than 5% from their pantry replaced sucrose with minimal dextrose, cooked curries from scratch, and lost 18 kilograms. Pre-diabetic blood glucose readings reverted to normal, blood pressure readings eased, and energy levels rose. Behavior change gains compound at the community level. Yandera Primary School in South Auckland banned fizzy drinks, acquired water bottles, and embedded nutrition lessons. Within 2 years, teachers recorded calmer classrooms, slimmer waistlines, and parents requesting recipes to replicate the school's whole food lunches, proof that when the environment changes, so do habits. Manufacturers calibrate sweetness through iterative taste panels, often composed of marketers or office staff rather than nutritionists, until surveys confirm the formula eclipses competitors on liking scores. The resulting products reliably undercut healthier alternatives, reinforcing a commercial loop in which cheaper, sweeter items dominate shelf space and consumer baskets, and dulls satiety signals in the brain for parallels that match cigarettes. Ubiquity, delayed harm, persuasive marketing, and mounting epidemiological proof. Muffins and biscuits convert to blood glucose almost as rapidly. Clinical consequences appear across the healthcare system. The Middlemore Hospital's dialysis ward. Rows of machines purify the blood of patients whose kidney failure often traces to type 2 diabetes driven by chronically high sugar and refined carbohydrate intake. Each patient costs the public system as much as 100,000 New Zealand dollars per year. Vascular surgeons amputate toes and limbs after poor circulation meets nerve damage. Ophthalmologists confront sugar-induced retinal disease. Dentists see the youngest victims. 2-year-olds under general anesthetic, while surgeons pull baby teeth dissolved to the gum line by fizz. A single 600 milliliter lemon lime soda standard fare at children's parties contains 16 teaspoons of sugar. 5 days allowance for a preschooler in one gulp. While many consumers initially dismiss the claim, deeper inspection quickly revealed how thoroughly sugar saturates modern diets. Supermarket audits show it hidden in plain sight. 2 teaspoons in a 20-gram smear of chocolate nut spread. 7 in a single portion of yeast extract once promoted as savory. 1 in every squeeze of ketchup. 4.5 cups of baked beans. And enough fructose in a 250 milliliter all-natural juice box to rival cola. Labels disclose the numbers but are easily overlooked amid price promotions and bright graphics. Food technologists explain why producers add so much. The scale of consumption is startling. The average adult in New Zealand now ingests roughly 32 teaspoons of added sugar every day, 3 times the World Health Organization's safe ceiling for men and up to 8 times that for children. While refined starches such as white bread laboratory markers echo the clinical picture, industry leaders counter that nutrition is a matter of personal responsibility and warned that taxes on sugary drinks would burden low-income families. Evidence from epidemiology, metabolic research, dental surgery, and real-world interventions converges on a clear message. Excessive added sugar is a prime driver of modern epidemics: obesity, type 2 diabetes, fatty liver disease, cardiovascular illness, and rampant dental decay. Thank you for watching Summarized, and be sure to subscribe.